program is going around, and this month is the nutrition problem. On behalf of the Disease Center Climate Change, Lakeside Education Trust, International Pediatric Association, I extend a warm welcome for you all. To officially inaugurate this one, I would call none other than the founder of this Institute of Disease and Climate Change, Professor J. Srinivasan. So I think he's a man with words and with action. Less the words and more action. And is one of the brilliant scientists. Because of him, this has come forward, and he is an authority in the atmospheric science and in the monsoon and predicting. And I said he practices what he preaches. I think each one of us has to reduce 2 tons of carbon dioxide to remove the carbon footprint in the world. And he walked from Malaysia to here on foot every day. And also, you don't use any car. Even marketing, if he goes there, he walks there and all those things. So all this thing is instead of 2, he's decreasing of 4 tons of carbon footprint. These are all the values we can come, and he encourages the academic so much, unbelievable. I think we always have a pleasure to learn from him. Any new thing he just forwarded to us, we have to say comment on that one, interaction. This makes us keep going as a great human being and a visionary. That's how the institute has come up this much. With this thing, I request him officially to welcome all the audience and inaugurate the program. Thank you, sir.
Good afternoon. All of you are aware of this monthly program that Dr. Parmar organized for the last 3 years. Most of the time we hear from doctors who tell us about diseases and how climate change is going to change it. So for a change, we have a different perspective today on nutrition, because remember, if you're lucky, most of the time we don't have a disease, but we still have to maintain our health. And for that, nutrition is very important. And climate change will have an impact on the ability to lead a healthy life. So I'm very happy that Dr. Parmesh has invited an eminent nutritionist, this is Anand, to give a talk on the impact of climate change. I request Dr. Parmesh to introduce the speaker.
Thank you, sir. Next is the introduction of the speaker and giving some highlighting about today's topic. And if you look at the sustainable development in the world, they started 2015, it goes up to 2030. It's none other than Rudiger Krush from WHO, he's a dear friend of mine, sir. He started it. Earlier, 2015 was the social determinant of health. There are 17 items in that one. 3 are the most important. What are those 3 important sustainable? Air, water, and food. 3 important ones. You cannot live without breathing more than 3 minutes. You cannot live without drinking water for more than 3 days. You cannot live eating food more than 3 weeks. All the 3 comes there. Food is an important. Whoever is the father of the disease, bad nutrition is the mother of the disease. That is Indian adage. We have to adhere to that. So World Food Day celebrated every year on the October 16th. It was created in the year 1945 by United Nations Food and Agricultural Organization. Currently, we have enough food to feed everyone in the world. There are more food than what is available, but it is not distributed fairly, efficiently, because every country is not cooperating, compromising in this context. Recently, 193 global leaders made a historic commitment to eradicate hunger and malnutrition in all forums by 2030, by end of this sustainable development period. The majority of the people who live only on $2 per day, that's what Lancet diet has said $2 per day. It comes out 200 rupees per day. But many of us, we cannot able to afford that one also. The agriculture for their livelihood, they are the people of the small agriculture. They live on their livelihood, and we need to be empowered the smallholders threatened by climate change. You don't live on oil and gun, but on water and grain. To talk this important thing and various diseases, we have with us the eminent dietitian, Mrs. Hema Arvind. Mrs. Hema Arvind is complete her BSc Home Science and postgraduate diploma in dietetics and public health, nutrition, and RD from the Lady Arvind College in New Delhi. And registered dietitian. At present, she is working as a chief clinical nutrition and dietetics at Ramaya Memorial Hospital since the past 16.3 years. She has about 30 years of experience. She does IPD rounds and counseling involved guiding the RD interns and other BSc, MSc interns, as well as taking classes for the MBBS students on nutrition. Students giving talk on TV and various forums, organizing awareness programs, nutrition for the public. She has involved in clinical trials and diabetes and dietetics. I think the topic she's going to speak on impact on the climate change and the nutrition, a special attention to the diabetes, kidney and allergic disorders. Over to you, madam. So thank you very much for accepting our invitation.
Namaste all. I would like to first thank the organizers for this opportunity. So when I was talking to Dr. I said we are neighbors of IISc, but believe me, this is the first time I've stepped into IISc. So it's really a great privilege talking to all of you, and whatever little. So I haven't done much reading about climate change all these years. Maybe not of much interest to me, but now it's become interesting to me because I was given this topic. So I went through, maybe in the last few days, I went through some literature, and whatever I could understand, I put it together. Hope it gives you all, good insight into that. Basically, we all the whole time are dealing only with diseases and nutrition. Maybe not much thought into climate change, but from now on, we would like to do that. So as doctor said, the World Food Day is celebrated every year, 16th October, basically to create awareness and prevent malnutrition, which is, see, when we talk about malnutrition, most of us think it's like undernutrition, people who are dilapidated. But believe me, it's not that. It could be both over and under, not always undernutrition. So the theme this year is water is life, water is food, leave no one behind. So I think now you all agree what doctor said. He said air, water and food. These are most important. That's why we say water is the elixir of life. But many of us maybe at times do not look at it, or, don't have much discipline regarding that, whether it's wasting water or not drinking enough water to keep ourselves hydrated, which as we go along, you will realize that what all dehydration can do. So climate change has twofold effect on global nutrition. One is the extremes in the weather can destroy the livestock. And what happens? Obviously, no livestock, no plants, lesser food supply. The second is, as doctor was mentioning, Professor Srinivasan is doing a lot on CO2, and he himself is following what he preaches. So too much of carbon dioxide in the atmosphere can reduce the nutrition. So many a times, believe me, there are people who would be eating, balanced diets, but then maybe lacking in some nutrients, especially the micronutrients. One of the reasons could be this: what they eat may be lacking in that nutrient. And what is responsible for that could be the climate change. So it's a vicious cycle, okay? And we have to get out of that. And just when we were coming in the lift, Professor Parmesh was telling, it's the future Earth, right? So it's not what we live now or what is past, but the future that we have to look into. And all of you here are doing a lot of work on that. So how do we go about it? So how do you do that? It's making it harder to produce food. One thing, the climate change, maybe monsoon, drought, or whatever is the reason we are not able. See, like few weeks back when there was rains, some parts of let us say Karnataka said the farmers were happy because it rained. There were some other parts where they lost everything because of so much rain, right? Then it's reducing the nutrients. And so where do we get our nutrients? From what we eat, right? So it's reducing the nutrients, and then it's also contributing to food shortage. So it's like a vicious circle. We have to do something to get out of it. So what are the strategies? The first thing you read is, which I read, was change the world's eating habits. Yeah. So change the world's eating habits. So when I was reading this, I was a little bit happy, maybe 5-10%, because I'm a vegetarian, because this says that switch over to plant-based diets that are better. Because as we go through, and I don't think I need to tell you, but I do have a slide which talks about the carbon footprints. And believe me, the topmost is what I saw was beef. So it's like switching over to plant-based diets. And believe me, why I say this is there are a lot of patients in our hospital. This is just out of the context. I thought I should tell you. Most of them are non-vegetarians, and our hospital is a vegetarian hospital. So believe me, and I tell them I am here because it's a vegetarian hospital. Otherwise, I wouldn't be here. So there are, like today only we met a patient who had got fish from home and was eating it because he had not eaten fish or chicken for the last few days he was here. So it becomes very difficult to convince them. They tell us, your vegetarian food is not giving me any strength. How am I going to get better? So at that point of time, if we start speaking in favor of plant-based diet or being a vegetarian, it's not taken. See, an audience like this would still listen to it, but a patient who is sick will not listen to it. So this concept, I sometimes feel, I mean, maybe it's not that because I'm a vegetarian, there are people, अरे अभी नवरात्रि है, अब तो हम कुछ नहीं खा सकते, कब से खा सकते हैं? Just got out of dengue fever, when can I start eating non-veg? So I jokingly tell them, is that what? I'm sorry, I don't mean to offend any of you. It's just that, is that all? Why can't you get good nutrition from? Don't you agree, or do you agree or don't you agree? Yes, but only thing is you need to plan well. Then encourage sustainable agriculture and food practices. That means improve the soil quality and select those crops which will be good in the nutrients. And last, see, this is also something which I, was wondering. Increase investment in fair science-based solution. So what it says, the countries least responsible for this issue, they are the vulnerable ones, as doctor was saying. So it should be the rich countries who are responsible for all this happening. Maybe the increase in the carbon footprints because of the lot of, animal food that they eat, they should come forward to help the other country. So at the end of the day, it's all like a teamwork, as you said. So it's a Vasundhaiva Kutumbakam. All of us are one family. It's not that, listen, I am at a top level, so I don't care what the others do. See, beef is the top one. Then if you see, everything is animal except the grains, tofu and nuts. So carbon footprints that we are leaving behind by doing this. So basically, would you all agree if I say that what the tongue likes is not good for health, and what is good for health, tongue will never like it? Do you all agree? I try and tell this to my patients, and they think like this lady is crazy because she has to convince us she's telling something. But is it a fact or no? Yes, because most of us would be at least 20-30% eating for the tongue, right? If somebody is given food here, like all of us at home, if the person cooking forgets to add salt, would you all eat it? Yes or no? I would eat it. Sometimes I do miss out, so it's not that I have to add salt. Okay, amen hakotvi, but that time we would eat it. I had been to this place in Wardha, Paunar, Vinoba Bhave's ashram. 1 week in a day, 1 day in a week, which is Thursday, they don't add salt in the food. And one day, I think Friday is Maun Vrat. Gandhian principles, because Vinoba Bhave was a Gandhian. Can we do that? I can't. I think even for a second, we can't be quiet, and we all would want salt, right? So basically, that's what it comes to at the end. So when I talk about climate changes, I thought I will choose 2 or 3 things which I could think of. The first one being heat. So we all know about global warming, right? So there are countries where it should have been now, winter should have begun, but still it's very hot. Even Bangalore, for that matter, if you take, days are so hot, right? It's almost October end. So could be, I'm not an expert, but I actually think it is global warming. And always we should, I think you all would agree, the vulnerable age groups are the children, women, especially the pregnant and lactating, and the geriatrics. So those are the ones who are more prone to all these changes. There are something like external and the internal factors, which could be social and physico-chemical environment. And inside is all our microbiome. Do you all know that gut microbiome is the latest research topic? Because it's being said through research that the gut microbiome plays a very important role. So if I have not been good, in my eating habits, and my gut is not good because of the microbiome, I would get a lot of diseases. So basically it's the gut. Now, how you take care of your gut, which is basically obviously related to what you eat. So we should not abuse our gut. Eat properly, but do not abuse your gut. Okay. So because of this heat stress, people with comorbidities become even more prone to other diseases. And if you see people with diabetes, so as doctor wanted me to speak on diabetes, they are very much susceptible to high changes in temperatures and heat waves. Lot of reasons which will come as we go ahead. So what happens is the fasting blood glucose and insulin resistance, which is the cause for diabetes, it changes or it is mediated by the temperature changes. Why? Because as the temperature changes, whether it's very hot or very cold, don't you agree our physical activity will change? Yes. We don't want to go out during the daytime because it's very hot. And if it's very cold, we make excuses. Hey, aaj bahut thand hai, I will not go for a walk. Bahar dhundla hai, to I will not go. There is fog. It's very cold. So we try to find these excuses. And I think we all should understand lack of physical activity is laying the foundation for various. So when, doctor said that Professor Srinivasan walks from his home and even goes by walk for his marketing, I was really, it's amazing, because I cannot say I would do that because I stay 20 kilometers away. So maybe I cannot start walking, but may take a little bit of, motivation from him and start doing things. Maybe if some place is close by, rather than, take out a 2-wheeler or a 4-wheeler, go by walk, right? So do you all agree? Little bit we all put effort. What is going to happen? Squirrel, Alil Seve they call in Kannada. The squirrel. So what the squirrel did during the Ramayana and all, small squirrel is not a big thing, but little it would bring and help. So Alil Seve. So we can also do a little bit from our side. If all of us in the world think like that and do it, it would be a better and safer place to live, right? So people with type 1 and type 2 diabetes have altered response to heat stress. So there would be a lot of vasodilation and sweating happening, right? So what happens many a times because of this, there may be people who may not be eating well, especially diabetics. They may be just because it's too hot, I can't eat, maybe just drink something and not taking care of themselves. Another thing is, which I'll come in the next slide, is also there are some medicines which are heat labile. So if I don't know how to take care of those medicines, and then it loses its efficacy, but I'm still using it because I have to use it. So that also matters. So what happens? The elevating of global temperature plays a role in increasing the diabetes. You all would be aware that we are going to become the diabetic capital, right? Do you know that? Every 4th Indian is a diabetic. And now what we are seeing, doctor, is we haven't done any study, but post-COVID, we have a lot of people becoming pre-diabetics. So they refuse to believe if we tell, because their results show that lab reports, their HbA1c would be anywhere from 5.8 to 6.5 is a pre-diabetic range. They would be 6.1. Today I told somebody, they are saying, no, you must be mistaken. Why are you telling I'm a diabetic? I said, you are not a diabetic, you're a pre-diabetic. And if you don't take care of what you eat and your activity, you would come into the diabetic range. So we are seeing a lot of people any age, which was not there a few years back. So could be, which I have read, because of the post-COVID issues. Maybe your eating habits have changed, your physical activity have changed. Diabetics have said, oh, we were not doing any activity when during COVID. COVID has gone, thankfully, but they still think it's not safe and they stop doing activity, which is not going to help in their diabetic control. Do you agree to all this? Mental health is affected in extreme heat conditions. Okay. Some medication. See, insulin, it is told people with diabetics who are on insulin, who are dependent on insulin, they have to store their insulin properly. If they don't, it will be there, but it will not be effective. So what will happen? The person will be taking insulin thinking that it's good, but it may not have any efficacy, and then their sugars will not be controlled. So basically, this is very common among diabetics. Air pollution, again, when I was listening to Professor Parmesh, I was thinking like so much of work is being done here, and I have a little something which I gathered by going through different literature. So we all know that air pollution is also a reason for insulin resistance. What is insulin resistance? Our body makes insulin. You all know that the pancreas make insulin, which is required for the blood glucose to enter the cells for the metabolism to happen. It's food for the cells, right? We don't eat it as glucose, we have it as food. But for the body, it is glucose. So insulin resistance means the glucose is not able to enter in a common man's language. It cannot enter the cells. So what is going to happen? The blood levels of glucose increase. Right? So slowly, if you don't take care of it, you turn it into a diabetic. And it has been estimated that approximately 1/5 of the global burden of type 2 diabetes, 1/5, could be attributed to pollution. So how do we take care of the pollution? Any ideas? You should be able to tell us better. How do you do it? So all diseases, there are studies which show that pollution is also risk factor for cardiovascular diseases. See, people who come to hospital, there may not be so much of workup being done. Suddenly you hear people know they had an arrest. We call them, doctor would know, MI, myocardial infarct, heart attack. Or again, they would have no comorbidities, nothing. Suddenly. One reason could be the pollution, right? But I don't think people would work on it. Could be is what I feel. Air pollution and then also low birth weight. So obviously a child is preterm. What is going to happen? It will take a longer time to come to its weight for its age, and then immunity has to improve, and then the child, is prone to infection. That's why they are all kept in the neonatal ICUs. Poor air quality limits physical activity. Do you all agree? After Diwali, for how many days we don't go for walk? There is so much of air pollution, right? I'm not sure about the statistics, but I think Delhi is the leading one in terms of air pollution, right? So people don't want to go out for a walk. So ghar pe they'll do treadmill or cycling, but they don't go out. So how do you get fresh air? So one of my slides talks about the immunity change if you're living in an urban environment and you're in a rural environment. So I was telling there's so much of greenery here. So environmental science does make sense if you're in such an institute, right? But not everybody is blessed to have this kind of an environment. Mold exposure. See, we suddenly feel, have you realized or have people around you told you, I'm getting this cough, hogodela, we keep, that's all allergies. So what it could be mold exposure because of not here, but generally flooding, then too much of moisture. There are people who are allergic to it. One of my own colleagues, she keeps getting cold and cough very often. It's an allergy to pollen. So how do you walk outside if you're allergic to pollen? So how do you take care of all that? Improve your immunity. See, this is what I meant. Urban and rural. Rural population, is in a habitat rich with flora and fauna, right? That means so much of greenery and everything else. Whereas we may not have that biodiversity in a urban environment, unless you happen to be in Tata Institute, right? So not everybody is lucky enough to be there. Then we come to allergies. It's very common. I don't think we would have heard the word allergy so much maybe when we were young, but now for everything there's an allergy. Food allergies, different. We have heard about it, but then other allergies. Suddenly you get this cough which does not go. There is no infection, nothing. But why are you getting this cough? It's because of the allergy. And what I remember when we were young, I've been in Delhi always that time. I used to hear that Bangalore is not a suitable place for people with asthma to live, for people with allergies. Am I right, doctor? So, because of the pollen and so much of pollution. Even now, people who have that, that's why our admissions in the hospital during this season is more because of this wheezing, exaggeration of COPD. That's all basically wheezing problems, bronchitis, and all that. The carbon pollution and warmer temperature cause plants to produce more pollen. Imagine. And that pollen is going to cause issues to a lot of people who don't realize that it's because of the pollen. There's something called extreme weather events, which could be, what all do you think it is? Heat wave, drought, flooding, storms. These are all called as extreme weather events. And this exposes people with diabetes to multiple challenges. Among the multiple challenges is impaired access to primary care. If there is a flooding or too much of rains or storm, a person who is diabetic and is sick cannot access or go to his doctor or a clinic. So what do they do at home? They can't take care of themselves. So it could lead to worsening of the situations. And then increase psychological stress and alteration in lifestyle because you can't go out. Physical activity gets reduced. You are just sitting at home, getting more stressed, which happened also during COVID. You can't go out anywhere. You don't know what to do. People, especially who were into IT, were working from home. We had to come to work, but only on alternate days. So all this was affecting the glycemic control and diabetes management. So this is something I found. I just used it. It says that Sam Mayers, director of Planetary Health Alliance at the Harvard Shan School, he found that when crops like wheat, corn, rice, and soy are exposed to carbon dioxide at levels which are predicted for 2050, that means we have another 25 years to go, they lose a lot of their micronutrients, which is zinc and iron and proteins. So I still keep taking, this is good for zinc. So when I go further, you realize zinc is a micronutrient, which means we don't require zinc in large quantities, very little. But that also, if you don't get, what happens? It's needed for immunity. Those of you who have had hair fall or who know people, the first thing doctor says is could be zinc deficiency. So, eat foods rich in zinc. So a lot of things can happen with micronutrient deficiencies, which we may not be. Iron, I don't need to tell you, it's for your hemoglobin. And then if you're anemic, what all can happen, right? So essential nutrients, zinc, iron, these are all essential nutrients. We require them, but in smaller quantities. That's why at the end, I have said a balanced diet is the mantra or the answer to everything, because include every food group in your diet, you can get over this to some extent. Not being, only prejudiced or focusing only on particular food items in your diet. So there are people in our setup we see who will say, I will not eat this, I will not eat that. Just because somebody has told them, and then they may be losing out on nutrients. So have a balanced diet, okay? So zinc is required for a fully functioning immune system. Iron, building block of hemoglobin, the molecule that moves oxygen and food into your bloodstream. So if hemoglobin levels are low, what all it's going to be? First thing is fatigue. You will not be active. You will be feeling tired all the time. So it's also going to affect your work hours. You're not being productive, right? So a lot of things happen. So basically, if you see the climate change, heat, air pollution, extreme weather events, change in the microbe or virus host interaction, vulnerabilities, there is impaired skin blood flow, impaired sweating, cardiovascular diseases, CKD, which is chronic kidney disease, depression, reduced pulmonary function. And the characteristic is hyperglycemia or weight gain. Outcome is heat-related disease. You could end up with cardiovascular events, kidney failure, decompensation of metabolic control, or infections, worsening course of infections. And in all this, diabetics are more prone to everything because their immunity is low. So any infection, as it is a diabetic, it's difficult for them to get out of it. And if they don't take care, this climate changes, it makes it even worse. So kidney disease, one of the reason I found could be the high temperatures. So what is going to happen? Dehydration, if you don't hydrate yourself well. So what happens, patients with pre-existing kidney disease, because they are not, if they do not have good urine output, they would be on fluid restriction, right? Fluid restriction, they restrict the water they take. So that could further cause problems for them. Hyperosmolality. So heat stroke, both clinical and subclinical, may have a major role in causing both acute kidney disease, leading to increased risk of acute kidney injury from heat-induced inflammatory injury. So it usually would be AKI. So one of the common things which we see is patients coming with acute gastroenteritis. We also call it acute GE, which usually is found in the summer season because of the food they eat or the water they drink. Okay. So what is going to happen? They'll be having loose motions and vomiting, and they will not eat. Any of us for that matter, if I'm vomiting, I would be scared to eat or drink anything because it would cause further vomiting, right? It's not a pleasant experience. So that causes dehydration, and dehydration commonly affects the kidneys. So I keep telling my interns in ICU setup, if you see acute GE with AKI, that's because they would not have hydrated themselves. So it's always, I mean, I do not wish that it happens, but if it's the case with any of you, please keep hydrating yourself, little, at least to drink water or ORS and keep yourself hydrated because you do not realize what it could lead to, right? Recurrent heat and dehydration can result in CKD. And then where workers are exposed to extreme heat, you may have people, a lot of CKD happening. And also there is a problem of kidney stones. This is very common. You may not know it. You find them coming to the emergency or ER as they call, midnight, early mornings with pain. I mean, excruciating pain which they can't control. And the cause is not anything related to your food or abdomen. It's because of the stone which is causing you the problem. So one reason for that also could be that you're not good with your water intake. So we give diet charts to patients. And one thing I tell patients who come with stones is, first thing is at least 2 to 3 liters of water if there is no clinical reason to avoid it. And there are many of us who don't like to drink plain water, right? So have it in whichever form you like. Second, do not stagnate urine. That means do not withhold urine for a long time. Many of us do not like to use the washroom in workplaces, right? So for hours together, you do not pass urine that is collected in your bladder that precipitates out the stool. But it's not that it happens to all of us, but people who are prone to it. And then also urinary tract infections. So specific characteristics of climate change such as heat, air pollution can have severe consequences for vulnerable individuals if they don't take care. The rise in ambient temperature can increase the risk of dysregulated blood glucose levels for those who are using, we call them as OHAs, oral hypoglycemic agents, the tablets which we take to control our diabetes. So again, you see vulnerable age groups are 65 years and above, the geriatric age group, along with if they have other comorbidities like hypertension and cardiovascular diseases. Another thing which happens in the climate change is transmission of infectious diseases. And more than 58% of viral, bacterial and fungal infections have been found to be worsened by climate change. And why is it worrying? Because people with diabetes are more prone for these infections. And infections, repeated antibiotics, repeated admissions to the hospital creates more problems for them. Because you're coming to hospital again and again. So there are chances of hospital acquired infections. So that also we need to, and also it could alter your immune responses. This little last few slides, I thought I would talk about drought. As I said, Water we can't do with water. What did doctor say? Do you remember? What did Professor Pomish say? How many days can you live without water? Do you all remember his statement? No. Huh? If that is the case, then I don't know what you will remember about what I am speaking. So 3 days without water, 3 minutes without air, right? And 3 weeks without food. So water is must, right? And we need water for everything, for cooking, for drinking, for sanitation, hygiene. So severe drought may reduce our access to water. So what is going to happen? Due to increased household water collection during drought, people try to store, right? What do you call it? Hoarding. But I can't say hoarding of water, but you keep water because there's drought. So that stagnant thing could lead to, we all know. Do you all agree that the most common thing happening now, you find people with low platelets because of dengue is because also there is water stagnation, right? Then if there is drought, you can have concentration of chemicals, heavy metals. And what is that going to happen? It's going to contaminate your groundwater. And if we start using that water, what will happen? Contaminated water if you use. Lot of other things. So there's one more slide which talks about, yesterday I read in Deccan Herald, how much of pesticides and chemicals are found in the vegetables that we people are eating in Bangalore. I think most of you would have, who read Deccan Herald would have seen it. I was like, so what do we do? All of us can't have a kitchen garden, right? So what do you do? So it's like question mark, what do you do, right? So as communities draw on groundwater, what is going to happen? Groundwater is going, your road starts sinking. See, the land sinking puts infrastructure like roads, aqueducts, and levees at permanent damage. So do you, I mean, how it is, connecting each other. See, then the effect of drought on physical health, food security, economic livelihood, everything at the end will impact your mental health. So it's not always the physical health. Wildfires. I'm not sure if we hear so much of wildfires in India, but we do hear about it in the Western countries. So obviously what is going to happen? Particulate matter increases. That again is exposing you to all respiratory illnesses and cardiovascular diseases. Community engagement and education, I thought I'd just see. So basically we need to educate communities, to switch over to sustainable local food systems. So ragi, that reminds me, ragi is a millet, right? Which people here commonly use. So and ragi actually is not very good for diabetics on a regular basis. So, but there are even doctors, clinicians who have told ragi is what we are born with. In the sense we eat ragi, that sari they call, it's a porridge kind of a thing, which starts from a younger age, 6-7 months, they started on sari. So how can you say that it's not good for us? So that is what we should think about. Locally, what we make, switch over from animal-based to plant-based diets. Talk about urban farmers markets, community gardens, and organic food. But one more thing about organic food. So I was attending this meet where I was told, do you all know every, say, locality has 4-5 organic stores nowadays, right? So I was told that all of them are not organic. So there is a particular, just like you have your FSSI mark, there is a mark which you should look at, and then that shows that it's organic. So anybody and everybody cannot say that I have an organ. See, they say we have a farm somewhere, some kilometers, not thousands, 100 kilometers away. Nobody would go and visit that place, right? So how do you know it's organic? But we all get carried away by that organic market or organic store, and you buy things by paying double the amount thinking it's organic. So please do not do that. Educate food handlers about climate change related increased risk of food contamination and how to maintain hygiene in food preparations. When there's extreme heat and water shortage, how do you cook food? And how do you make sure it does not get contaminated? And then educate healthcare providers on the health impact of climate change and food system and how do you protect them? Because so I felt that the solution to all of this is a balanced diet. So we all learn about food groups. So one of them is milk and milk products, cereals and pulses, fruits, fats, meat and meat products. So include food from each of these groups in all your meals. Stick to seasonal availability rather than the non-seasonal ones. What is the purpose of buying some fruit or vegetable which is not in season? For example, mango. In December, if I say I paid 1,000 rupees per kg and bought a mango and served it to my guests, do you think it is something to be proud of? No, because we know how that mango has been kept, right? Apples, when they are not in season, you all would have read about it, right? How are the apples stored? They have that covering on them, wax to store. But we are thrilled with life because we have read and heard often again and again. An apple a day keeps the doctor away. So please focus on apple. Believe me, the first thing I tell patients is, please do not only go by that. Eat all seasonal fruits and vegetables. So next I've also shown my plate, which is there. A sensible inclusion of food from these 5 food groups is needed for good health. How many of us do that? Just look at this, my plate. So if you look at the my plate, half the plate should be fruits and vegetables. If you're a diabetic, yes, you can't have a lot of fruits, but if you're normal, you can have fruits and vegetables. So half my plate should be fruit and vegetables, my dear friends. The other half, quarter should be protein, which could be plant-based or animal-based, depending on what you eat, and grains, that is cereals, which are what gives you energy. So that is called as protein sparing action. There are a lot of people who do different diets, right? Have you all heard of keto diet? Or do you all follow it? How many of you follow it? So no carbs. But that is what. See, tell me when you're eating food. Today lunch if you had. Did you have protein or did you have more of rice or chapati, whatever you ate? Usually the more quantity would be the cereal because that gives you satiety and we think that keeps us going for a longer time rather than just eating fruits and vegetables, but it is not the case. Oils, and see, dairy products are supportive. You don't require to drink lots of milk, lots of paneer, etc. because it's good. That's supportive. That's why it's at the outside of the plate. Right? Oils. How many of us know that we require only 3 teaspoons of oil a day per person, half liter per month? So those of us who eat in mess, we can't have a control on that. But if you're at home or you're cooking for yourself, so many a times when I tell this to patients, the lady of the house can't stop giggling because they do not keep a check on that. A 15-liter tin is bought, they go on using it merrily till that ends because next month they know another refill will come. And we should change the oils we use to get the perfect ratio of MUFA and PUFA, monounsaturated fatty acids and polyunsaturated fatty acids. So it's from sunflower, which we all use, groundnut, mustard, which some parts of India use, then olive oil if you want to use it, rice bran, safflower. Keep changing the kind of oil. Do not see, there are some smart people who say, shall we mix all the oils? No. You can either buy one oil this month and take another oil or different oils if you're buying sachets. These are all not a part of my topic, but I thought being here, let me just talk a little bit of my profession, which is nutrition. When we talked about, food handlers. So how do you all cut your fruits and vegetables? Many people are very, what should I say? They're obsessed with that, that it's not clean, there will be pesticides, we don't eat, or they go on cleaning it. So Professor Srinivasan saying the most of the vitamin B complex are water soluble and heat labile. The more you keep washing, you are losing on your vitamins. But to keep yourself happy that it's clean, it's clean. So what we do in hospital or industrial setups is there's something called Sumo tab, which is basically chlorine. We use that. So the fruits or vegetables. Okay, one more question, which is again, let me see how many. Do you wash the fruits and vegetables whole and then cut it, or do you cut it and wash it? That's why you're all doing PhD here, right? Because what will happen if you cut and wash it? Why? The area exposed is more, right? When you cut it. So you lose out on the water soluble vitamins, right? So always wash it as a whole and then cut it. And then make sure that, you rinse it properly for a few minutes. You can use salt, which is a very good agent. Sumo tab, everybody cannot use at home because it's not available commercially. I mean, it's only for institutions that you find it. Or you can even use bleach solution. So dip it in that for some time, like you do for cauliflower or for bitter gourd to remove the bitterness. Like you soak it in turmeric water and salt water, no, for a few minutes or depending on the amount, and then clean it well and then use it. This is again, I thought, because we talked about food handlers, pesticides, the soil. One more thing, when we are talking to patients with chronic kidney disease, we talk in terms of the sodium, potassium, which they should take. So believe me, if you take the potassium of a fruit in India and compare it with that in the other Western countries, it would be different because of the soil content in that area and what we do here. One example for that is in the hilly areas, iodine, right? You have heard, right? That's why we say those areas people should use salt, iodized salt. The same way the soil matters, the nutrition in the soil matters. This is again, I don't know, I thought it would help people. Clean it well. And then it is, be sure to wash your fruits and vegetables. Do you know what's on your kitchen sponge? That is something which I liked when I was doing a presentation in Bangalore Medical College few years back. Do you know, see what we are very happy, we have a cloth in the kitchen. Yes. And we keep cleaning everything and very happily, oh, कल तो धोएंगे आज. वो कितने बार किसके से आपने वॉश किया है, किसको आपने उसको ड्राई किया है, वो भी तो मैटर करता है ना. That's why we have different cutting boards when you are using it. There's a separate color coded for animal products like milk, which we do not mix with fruits and vegetables. There's a separate for the meat because meat would have some microbes. We cannot use the same cutting board to cut vegetables. The same way, having one, see, you just see those are all microbes laughing away. कि भैया तुम मुझे यूज करे जा रहे हो, तुम्हें क्या पता है. हम उसी से कट्टे को क्लीन करते हैं. कट्टा is the platform where you're cooking, right? Same thing, you just dust it and then use it to dry your utensil. So that's what happens. What is there on your kitchen sponge? How dirty it is. That's why we should keep, I would not say different colored. At home, it's not needed that way, but different cloth you should keep. One to clean the gas and your platform and another one for your vessels. I just thought it would be some learning for all of us. It's not going, I think. This is like our signal. I'm done. Just see the same rice. It's green zone if it is steamed. Yellow zone, it's palav. Fried rice biryani is red zone. We are all very happy with the red zone. We all want to jump into danger. The same is for each food item. Whether it is green, yellow or red depends on how you cook it. So what will the tongue like? Steamed rice? No, I want biryani. But what will happen? Biryani is in the red zone. Your figure depends on your meal strategy. Eat breakfast like a king, lunch like a prince, oblique princess, because we have a lot of princesses here, and dinner like a pauper. What do? Breakfast is hurry. Khaye to khaye, nahi to nahi. Lunch is box or in the midst of a meeting, grabbing something. Dinner, अरे घर पहुंच गए अच्छे से खाते. या तो घर पे बनाओ या कुछ order करो. Order करने में तो you have so much variety, so obviously you end up ordering the unhealthy ones. The more you fill up on healthy food, the less space you will have for unhealthy ones. Do you agree? Will you do that? There is no good time like today. Do it now because sometimes later becomes never. Thank you. Just hope I put some nutrition to all your.
So thank you very much. Any questions, please?
No questions. I feel is everything understood or
Gone above the head. It is not true.
No, I'm just joking. Not with them. Generally, I tell my people like if there, it's good if there are no questions. At least everybody already knew more about it. I don't know if doctor has some questions for me.
No, I have some comments for you because you raised certain issues, health-related issue. So some comments. I think first of all, thank you. It's a wonderful talk. We enjoyed it. Diwali is the smoke you mentioned about it.
It just came out of the context.
No, that's what I said. How much it all? It is true. I think bursting of the firecracker rule has come there, and we are going to only burst 2 hours.
Who follows it?
Yeah, no, it's been followed. It's been followed. We have data to substantiate it. Before the rule has coming here, during 3 days of Diwali time, there is 100% increase the emergency room department from the wheezing, coughing, and also burn and eye burn and all this thing. That has reduced significantly. During that 3 days of time, there was 200 times more of sulfur dioxide in the atmosphere, more the WHO recommendation. After this rule has come, last year data shows it has come down to only 3%. That's significant. That's what these are some information. This is what sulfur dioxide significantly has come down. We're thankful for the society for that cause. And humidity, you mentioned about it, very important. We like to maintain relative humidity to the 45. Anything less than 40, dangerous, more than 45 is dangerous. Why? Because the mucus secretion, what you produce in the respiratory tract, nearly 750 ml to 1 liter. That mucus will be moved by the cilia, but about 10 to 15 beats per second and moves about 1 centimeter per minute. That cilia, if you export to that kind of humidity for more than 10 minutes, cilia don't work. The mucus gets stagnant. When it gets stagnant, the viscosity increases. That blocks the airways and make a good nidus for the infection. So for that reason, we have to maintain the relative humidity. If you have AC, we don't have relative humidity control, most of the houses. I think that is one of the reasons why it happens and all this thing. And the second thing about suspended particles, as rightly pointed out, I think upper respiratory tract infection is becoming more and more allergic rhinoconjunctivitis. Keep on rubbing the nose, clearing the throat, rubbing, and also snoring at night time. Don't sleep, disturbance problem. It has become more mainly from the less than 2.5 micron. Bigger particle 10 micron, they deposit upper respiratory tract. The 10 to 5, they deposit central airways. Less than 2 in the alveoli. Less than 2.1 2, they cross the lung. 7 layers enter the bloodstream. Enter the bloodstream within a minute. Radioisotope studies have shown within a minute, and it will spread within 5 minutes all over the body. That damages the tissue by oxidative stress. In womb to tomb, it has got us. So children who are exposed to that one, that are premature teeth and stillbirths and small for dead babies are related to that. This is some of the for learning purposes for our people. And kidney disease also becoming more and more, not only from the vasopressin and fructokinase activity. The glomeruli and also tubules are all get damaged. Most of them, they are drinking, instead of drinking water, they drink fructose containing. Fructose is extremely solute road, produces severe variety. Nearly 30% of them need dialysis. And that is a carbon expensive treatment, water expensive treatment. 7 times more carbon footprint it produces. So these are all the diseases you covered very well. Diabetics. I'm a diabetic, but for the past 20 years. So I've been small tablet I've been taking, but I'm taking the activity is more. We have to activity, we have to do it and restrict your diet. As you rightly pointed out, I think national Federation of the Food Safety Standard of India, they comment what the homemade food you eat, 80% of that one. Occasionally you have outside food, pizza and all this thing. Very rarely you can have packet food and all this thing. I think with some more of vegetarian diet that, and see correctly she pointed out, each kg of vegetarian produces 1 kg of carbon footprint. Meat, chicken, and all this thing usually start from the 1 kg. You got 5 to 35 to 40 per kg. 1 kg of meat, 35, 5 to 35. Beef is the highest. Red meat. I think that's what she has corrected very well. And with all this, we are very thankful. If there are no other questions or discussion, and as a token of appreciation, we request Professor Srinivasan give a smile memento for you to take it over. And after that, I request Joshita Sankam to give the vote of thanks.
On behalf of the Vichar Center of Climate Change, I would like to thank Mrs. Hema Arvind for being with us here today. Thank you, ma'am.
It's my pleasure.
I request the participants to please come for the group photo.
Come. Expert.
Oh, yeah, it's not so much of nutrition in this group went on the. It's always one back. 220,000. So how do those patients increase their ability